Depression, a word so commonly used yet so often misunderstood. It's not just a fleeting feeling of sadness or a bad day. Depression is a profound and pervasive condition that affects the mind, body, and soul. It's a global epidemic, casting a shadow over millions. From bustling cities to quiet villages, no one is immune to its reach. But depression is not just feeling a little down. It's a relentless weight that can make even the simplest tasks feel insurmountable. It runs far deeper, impacting every aspect of a person's life. Relationships, work, and even daily routines can become overwhelming challenges. It's a serious medical condition, not a sign of weakness. Seeking help is a sign of strength and the first step towards recovery. In the depths of depression, hope can seem like a distant memory. The world can appear colorless and devoid of joy. Yet, understanding this complex illness is the first step towards healing. With the right support and treatment, there is a path to recovery and a brighter future. We all experience sadness. It's a natural human emotion. It's a part of life, a response to the ups and downs we all face. We feel down when faced with disappointments, loss, or setbacks. These moments can be tough, but they are usually temporary. This sadness is temporary, fading as we process and move on. We find ways to cope, to heal, and to find joy again. Depression, however, is different. It's a persistent sadness that lingers, casting a dark cloud over everything. It doesn't just go away with time or positive experiences. Daily tasks become insurmountable hurdles. Even simple activities like getting out of bed or going to the store can feel impossible. Pleasure, once a welcome companion, disappears. Things that used to bring joy no longer have the same effect. This persistent state of despair is a hallmark of clinical depression, requiring professional attention and care. It's important to recognize the signs and seek help. The symptoms of depression are varied and often debilitating. Low mood, loss of interest, and fatigue are just the tip of the iceberg. Sleep disturbances become the norm, appetite and weight fluctuate. Concentration becomes a struggle, feelings of worthlessness and guilt take root. In severe cases, thoughts of death or suicide emerge. These symptoms impact every aspect of life, affecting relationships, work, and overall well-being. The causes of depression are complex and multifaceted. It is not just one thing that leads to this condition, but a combination of various factors that can affect an individual. Genetics play a role, making some individuals more susceptible. If a family member has experienced depression, it increases the likelihood for others in the family. Life experiences, such as trauma, loss, or chronic stress, can also contribute. These experiences can leave lasting impacts on one's mental health, making it difficult to cope with daily life. Furthermore, chemical imbalances in the brain are implicated. Neurotransmitters, which are chemicals that transmit signals in the brain, can be out of balance, affecting mood and emotions. Understanding the root cause is crucial for effective treatment. By identifying the underlying factors, healthcare professionals can tailor treatments to the individual's needs. Thankfully, a range of treatments exists, from therapy to medication, offering hope for recovery. Cognitive behavioral therapy, for instance, helps individuals change negative thought patterns. Seeking help is not a sign of weakness, but a courageous step towards reclaiming one's life. Engaging in physical activities like jogging or yoga can also support mental health and well-being.